So around the age of 5 is the first time that I can remember policy influencing my life. So I like to say that I've been thinking about policy since that age. And that's because I learned all of that in my home where I grew up. My parents ran a medical or therapeutic foster home. And so what that means is that it's a type of foster home where the parents have specialized training to take care of the most complex cases of mental, physical, or emotional behavioral issues with children. And so my home was a family where you could come to it in many different ways. You could be a foster child, you could be adopted, you could be a birth child, you could be an unassisted minor, a family friend, or maybe a family member that needed extra medical support and management. And so our home was quite dynamic. We had somewhere between 13 to 15 people living with us at any given time for most all of my childhood. And between the time I was born and the time I turned 11, we moved 9 times. So we were quite a dynamic, moving, and adventurous family. It was an experience that I was born into. But over that period of time, my family took care of over 150 of Oregon's most vulnerable youth. It was around the time that we moved, and when I was 11, that I started to realize that my family was really different than most families. We moved into kind of an urban neighborhood where everybody, had the similar looking houses, and it was then that I really started to explore how I was different. So when I was about 5 years old, I found this picture that I drew with the 25 bedrooms. So my point of view was really from this lens, and so it was a highly regulated home. It was a home where kids would come to our family with medications, specialty doctor plans, specialty schools, different types of visitors. And so all of those regulations that come from the state really dictated how our house ran. We had an administrative rule book in our living room. So our house was really regulated. And when my mom told me a story that when I was around the age of 3, I had come to my parents to find out from them what agency had placed me in the home. And my parents said, well, you're not a foster child, you're a birth child. And I didn't believe them at all because I wanted to belong, and belonging in my family meant being a foster child or having an agency that supported you. So since I didn't believe my parents, of course, we would have social workers that would come and provide services to kids in our house, and I waited. The story is I waited till the playroom was empty and the social worker was in there, and I went in there and I took my case to her and I said, I want to know what agency I'm with, and I want my meeting. And they said, you don't get a meeting, and you're not with an agency. And looking back at it now, I probably could have used some case management services. So I did eventually believe that I was a birth child, but it did take a while. So, but at the same time, even at a very young age, I did understand that there was a lot of trauma and traumatic experiences that brought the siblings to my home that wasn't lost on me. In addition, at a very young age, we experienced great traumatic loss ourselves. We would have children placed in our home who were family members there for many, many years, in some cases 5 or 6, and then there'd be a rule change about how long a placement could be with the family, or an adoption wouldn't be successful, and then those kids were basically disappeared. So you could spend your whole half of your adolescence with them, and they were just gone forever, which was highly, disturbing. And then there was also the experience of knowing that we had children in our family that would go on, court-required visitations and come back and tell us about stories of abuse. And we didn't have control or power in that situation as a child, and we could only report to the state what was going on. And so those kinds of experiences and the things that happened to my siblings really hardened me over time to the system. And so I grew up with this lens that that hardened me, but also created some beautiful strength. And I told myself at a young age, I would actually say, I'm going to change the system, but I'm not going to work for the government. There are lots of ways that I can make changes, but I'm not doing that. And over time, I learned that there's a lot of power in understanding how the system works and being able to be an influencer of policy. And I always thought you had to be somebody high up, really important, like a president or a governor or a legislator or commissioner, to be able to make changes in policies. But over time in my career, I learned that the people who interpret federal rules and regulations or write funding requirements or really are out in the community acting out the rules of the state or the government are people just like you and me, and that we can have those influences. So I wanted to share just a couple of stories about my personal career journey. When I was 11, that time when I started realizing I was kind of strange, or my family was different, we moved to a new neighborhood where there was a Boys and Girls Club that I could walk to. And the Boys and Girls Club immediately took advantage I took advantage of everything that they had to offer. I was there every single day. I found my place. I found how I could be different and step out of my family identity. And I loved it. By the time I was 14, I had my first job, and I was planning on working on Boys and Girls Clubs of of Oregon, actually, forever. And then as time went on, in 2002, I had a telephone interview for a job in Alaska to work at the Boys and Girls Club. And 2 weeks later, I was on a plane with a backpack and a pair of boots and came to Alaska. And it was at the Boys and Girls Clubs of Alaska that I really began to understand how the government has such a huge influence on the community outcomes, the resources that go to a community. And so when the opportunity for me to go work for the state of Alaska at the Division of Behavioral Health and work on alcohol policy came, I jumped all over it. But I'm not gonna lie, it was really, really boring at first. And I apologize to all the people that had to experience like the first 3 years of me working in government, because I came out of this really exciting, fast-paced environment with lots of kids and families. It was very much like my childhood home, really my comfort zone. So moving into working on statewide alcohol policy and being a subject matter expert and managing 26 grants wasn't exactly as fast-paced and as exciting, but I grew to love it. And actually this was the turning point in my career where I really started to understand some deficits in what I knew and what I could do, and that I really needed to pursue deeper education. At this job, I worked on what's called requests for proposals. So state workers will develop these requests for proposals that go to communities, and the communities can apply and receive funds. And in this case, it was many millions of dollars for comprehensive prevention. And during the process of writing this request for proposals, I really began to understand how my own unconscious bias and the institutional racism of the system that I worked in could easily move through my keyboard and into a community, because the definitions and parameters of what we actually write in those RFPs has a direct impact on who is in and who is out, so who gets money and who doesn't. And so not really being as aware of how that works and what I could do to change it, Dr. Rhonda Johnson was always kind of flitting around, encouraging me to get a master's, get an MPH, a Master's of Public Health. And after that process, I realized I really do need to dig deeper and learn more about how policy works and how I could be a more effective policy maker. And my boss at the time, Diane Casto, was my mentor and strongly supported it. And so I moved on, I got my MPH. And then, fast forward down the line, here I am at the Anchorage Health Department, and I'm very excited. It's kind of an unwritten story. I've been here for about 9 months, but working for the health department, I use my MPH every day. I interact with people from the university, colleagues, other students on a regular basis, and I'm really excited about where that's gonna take me. And most importantly, I wanted to leave you guys with this, is that, the process of getting my MPH was a family experience, and I reflected a lot in my current role about what I could take away from it, because all parents make lots of mistakes, and I'm making lots of mistakes right now as a parent, which helps me better understand my own parents. But the one thing they taught me was service, and they gave me that, and I wanted to think about what's the gift that I want to walk away with. And what I want to do is live a life that my children can be proud of. And so I challenge everyone here to understand that you can make a difference, that policies can be used for good, and that if you engage in it and step out of your comfort zone, that you can really make a difference. Thank you.